Well, again, thank you all for joining us. I think we have a few more signing on as we speak, but we want to go ahead and get started. Again, my name is Kourtny Garrett. I'm the president and CEO here at the Downtown Denver Partnership. So many of you have joined us in this very, very critical initiative to address the acute public health and public safety challenges that we're having in downtown today. I know that many of you are joining us because you were a part of our initial launch just a month ago. So we have some really important updates to bring you this afternoon, and we'll have time at the end for some question and answer. So to move into where we are today, we all know that these issues related to public health and public safety have impacted our city, which is really why we have all come together to come forward with a very holistic approach, looking at how we are maintaining a welcoming and safe environment for everyone in our downtown. Our downtown is the heartbeat of our city and the place where we come together. We know it's our economic center and our economic engine, and the place where we all make memories. So this has truly been an excellent example of partnerships. We have a number of action partners and advocacy partners who have been a part of bringing this forward today. To find more information, you can go to our website at downtowndenver.com/safety. We have a video for those of you who missed the opening press conference. There's a video on the website, as well as many tools that talk about each and every specific action that's been committed to this effort, as well as how you can get involved. So again, that's downtowndenver.com/safety. A number of action partners in law enforcement and our judicial partners have come forward with commitments to action, and you're going to hear updates from those folks here today. I also want to thank all of our advocacy partners who are joining us and who have signed on to this effort, pledging their support to speak boldly with one voice and to get involved to help move these actions forward. So with that, it is absolutely my pleasure to introduce Ryan Ertman, who is our Director of Public Safety here at the Downtown Denver Partnership. And he's going to speak to some of the progress of one of the specific actions that has been committed by many partners, our Downtown Action Team. So Ryan, I'll hand it over to you. Ryan, I think you're still muted. We'll all get.
Sorry about that. You got me now? Okay, thank you. Sorry about that. Anyway, thank you, Kourtny. I appreciate that. And more than anything, I appreciate all of the assistance and the resources that we've been getting. As you know, this Downtown Action Team has been an operational. It's been a really big operation to try and coordinate and get everybody's already packed schedules filled with some of the work that needs to be done here. So I want to underscore the amount of sacrifice that all these departments have made, knowing of all of the things that they're currently doing, and yet the tremendous effort they're giving us in the downtown area. So obviously these cross-functional teams that have been created are represented from all of our various agencies, DPD, SET, which is the street enforcement team, the fire department, the Dottie team with the city, Well Power, some of their clinicians, the STAR team, public health, substance use navigators. Just so many different units have come together to make this effort a reality and to really make it successful. We needed a lot of effort. We needed a lot down here, and these guys, these units and teams and people are just making it happen. If you could go on to the next slide, Kourtny. So this is some of the stats that we've been able to generate after a month of work, and these are constantly coming in because we have so many different teams, and these teams are staggered throughout the day and even throughout the week. So we have now 5-day coverage throughout the week and coverage from 7 in the morning all the way up until 3 in the afternoon from some of these teams. As you can see, broken up throughout the different departments, we've got DPD that has a total of 95 contacts, resulting in 39 summons and 11 arrests. And I break those up because people misunderstand sometimes what an arrestable offense is versus an actual arrest, such as a warrant where somebody's taken into custody. So I did break those down a little bit, but you can see the constant effort towards this, and I'll let Lieutenant Kendall speak a little bit more to the efforts that DPD is putting in, but the numbers speak for themselves. The SET team has been coming out throughout the day for many hours with many staffing hours for the people that they're putting in. You see the 96 contacts, warnings, some of the welfare checks, and they're also doing these connections to resources. Every contact is coming with outreach to try and get people help, again, where they need it, when they need it. Just at some point, they may just really decide that they're ready to get into some services and to use some of the things we're providing and the resources that are available. The outreach case coordinators that work with DPD, now keep in mind they work separate from DPD during the DAT program. So they're out with our clinicians and our medics, and DPD is operating on their own while the outreach case coordinators are working with the clinicians. You can see how many contacts they've had. They've been able to help a few people, provide people, assistance to some of their support, referral services, and we've gotten some people assistance through the STAR van and getting them into some treatment. So it's been, again, very successful there. You can see the substance use navigators with their contacts, the referrals to treatment, and the actively engaging basically means somebody didn't really want services at the time, but they're continuing to talk with the representative. And so it's that building that trust and keeping working with them so that we can ultimately get them to trust us enough to allow to go into some services and to get some treatment. And so it's very important. We have people actively engaging. That's really exciting for us. And then the public health investigators, they've had 72 contacts. These are contacts with businesses, property owners, managers, employees, trying to help and understand the importance of keeping the alleyways clean, the dumpster areas. And they've even provided some notice of violations to some of these businesses. And then, of course, our Dottie team that I just can't speak highly enough of. And as you've walked around downtown, I'm sure you've seen how much nicer some of these buildings and walls and just areas that were just riddled with graffiti. And you can see that they've had 1,700 square foot of power washing, 28,480 square foot of painting. It's just been an enormous effort from everybody involved. But more than that, real quickly, I know I don't have too much time, but more than that, I want to just speak to a couple of the instances we've had where our outreach team, again, this team that comes in separate with the medics, the outreach case coordinator, and the clinicians, they've been speaking with people in the morning. They've been out early in the cold weather, just meeting with people and just, again, trying to get that trust, handing out those hand warmers and water and all these clothing. I saw clothing today that they were handing out to somebody just to get that little bit of trust. And they've been doing a great job getting some people connected to resources. So I've been just very thrilled with what we've had. And we're even starting to move and be versatile right now because we're seeing some movement that we're not seeing as many people out, or we're seeing a lot of repetitive contacts, repetitive connections with people that are good. We want those, but it's the same over and over. So we're moving around and we're trying to be real nimble in how we're getting to the most people throughout the area. So with that, it's been pretty successful, and I'm happy to have it and very appreciative.
Thank you so much, Ryan. And again, I think as we look at those statistics, the numbers for such a short period of time to address something that we know is very individual. We know that each and every case has an individual root cause and an individual intent and an individual solution. So to see this type of movement in a collaborative way is what we believe is really making a difference, and we're committed to continuing in a very significant manner. It's now my pleasure to introduce our Denver City Attorney, Carrie Tipper, who's going to update us on some things coming from her office. I will tell you, we have over 40 of you who have joined us so far. So please feel free to put questions in the chat, and we'll get to those at the end of all of our partner presentations. So Carrie, I'll hand it over to you.
Thank you very much, Kourtny. Appreciate so much the opportunity to chat with everyone today. I thought what I would highlight are some of the things that we've been working on. And you just heard Ryan talk a lot about the Denver Action Team. We're, of course, supporting that team and kind of the legal underpinnings of what they're doing. But the good news is that we also launched, as some of you know, the Special Assistant U.S. Attorney Partnership. So what we call SAUSAs that are aimed for prosecutors, basically aimed at prosecuting federal felon in possession, or what we call POWPO, prior offender weapons possession. And we have hired all 4 of those. The first one just passed their clearance. So they're up and at least one is up and running, and we're excited about launching that program. The third thing that I'll mention, which is really in kind of incipient stages, is we have pulled together a task force looking at the, of course, intersection of mental health and substance use issues, and looking at all the tools that we have. We have a lot of tools to get people into evaluation and into care through a process called certification. One of the big issues is the resources available for people to actually get care, to actually go through that evaluation process. So we have been working with the probate court, which has been a great partner in helping us get people treatment that have substance misuse disorder, working with our partners in safety to kind of talk through the legal standards about when they can essentially bring someone to a hospital for care. So those are early conversations, just looking at the tools that we have and kind of re-envisioning how we use them. We're considering taking a look at sort of a pilot program in downtown Denver. So that is really new as of about a week ago, but just trying to be strategic and thinking that, one of the big issues that we see in downtown, of course, are individuals that are dealing with some pretty substance and mental health issues, and the intersection of those two. So those are the highlights that I have from the city attorney's office. Welcome any questions, and just appreciate the opportunity to talk to you all, and appreciate your partnership and support for what has been difficult but not insurmountable efforts.
Thank you, Carrie. And again, I am going to keep saying this, the importance of all of the different perspectives coming to the table and working together. And I know how much you've really been working on this and trying to find each and every tool and resource possible. So we're really, really grateful for your partnership.
Yeah, I appreciate that, Kourtny. And I'll just say one more thing. What's kind of anchoring that last effort is one of my attorneys who runs the mental health unit. She says, I spend a lot of my time on the phone with parents who call and say, how do I get my child into treatment? And there are a lot of options, but not a lot of great paths to those options. So what we're really working on is carving those paths for people, so we can make sure individuals that have advocates to get them help can get it, but also the people that don't, that we make sure they get the help they need.
Yeah, it's so incredibly important with what we're seeing block by block, day by day. So thank you for that. Let's now hear from Deputy Chief RTD, Deputy Chief Martin Gano, about the efforts and the commitments from RTD to this overall community push.
Yeah, thanks a lot for having me here today. Since the partnership that was developed here, we're continuing the same efforts, but for those that weren't capped back then, the DUS area, we have really devoted a lot of our resources. We continue to put our internal police officers within the geographical location of Denver Union Station to really work on all the great partnerships we've had with the city and county of Denver, the Denver Police Department, outreach organizations that we had done over the summer, and we didn't want to lose all those gains. So, we have full deployment there, 7 days a week, 20 hours a day, because our Denver Union Station is closed 4 hours from about 12:30 to 4 o'clock in the morning. But what we have been doing as well is also having some of that staffing on certain days of the week to also go out and ride the light rails, and also be on the outlying areas just to make sure that, with all the high visibility that we've placed in a geographical location, we're not also spreading the problem. We're also going out there trying to make sure that we're contacting individuals, and really in the beginning part is educational and outreach, seeing if there's services we could provide. And then if not, then we do an educational enforcement action to see if we have to, do something of that nature. We continue, as many know, usually the first faces you'll see is our security contract personnel. We've added additional security to the Denver Union Station area. We kind of divided up the bus terminal into about 3 quadrants to really have more of a static post, more visibility in those areas, and just having our security staff just be present at certain locations on a constant basis. So you should see that here as you're going down into the bus terminal, seeing a little bit more visibility and security officers in more of a designated location. As you know, we had opened up the bathrooms, the restrooms a few months ago. We have a security officer devoted to make sure we're monitoring that restroom area, and people are utilizing the restrooms for its intended purposes. So that's been really instrumental, and really has been a huge positive. We have our cleaning crews that continue to clean the Union Station area, the bus terminal, and the upper platforms. So that's on a continuous basis, and we're also still in the midst of revamping that area into a paid fare area. We've added a lot of signage, a lot of directional for people to come in and out. We added monitors for security purposes, so you could see that we have cameras throughout the system as you're coming down our escalators and our stairwells, seeing that you are on camera, just making sure people understand that this is a secure environment for them to come to. So that is continuing, and hopefully will be at that paid fare area in the near future. Staffing wise, we continue to grow here at RTD. So if anyone wants to be a police officer on public transportation, we are currently hiring right now. Go to our website. We hired 8 personnel that's going to start here within January and February. We have 20 candidates in the testing and background stages for police officers. So we're really hoping to expand our police internal staffing here in the next few months. And then we continued our budgets in 2023. We will still continue with Denver police officers. We hire them in a secondary employment capacity, so they are going to continue in 2023. A lot of that resources we have asked to also be present at Civic Center. So, I know a lot of emphasis has been at Union Station, but, Civic Center is also a major hub in the downtown area for public transportation, especially our buses. So we've asked for more patrols there and more visibility, and hopefully individuals are seeing better police presence in that location. And we're also going to continue to staff in 2023 with Well Power for our co-responder units. So we will have our mental health clinicians riding with our officers, our RTE officers, and we're also going to do our contract with our homeless outreach coordinator. That Alton Reynolds is his name. He has been doing the job of probably about 20 people going out there, really working with the cities and the counties within our RTD district, and really assisting individuals on trying to get to the resources. The really big measurable that I think could be had here is I receive every customer care call that comes in regarding anything that's security related. We've generated numerous complaints into the customer care area, but now we are starting to see individuals calling in telling us how clean Union Station is, how great the downtown area is, how how much support has been provided. And that's a true measurable that we can't give data numbers on, but I think the public is seeing that, and with everyone here and everyone's help, we're really seeing a difference. So thank you.
Thank you so much, Chief. And I can tell you that personally, I've seen the progress. I've had many meetings over the last week, and I'm getting very similar feedback. We know we still have a ways to go, but I think we're really beginning to see the progress altogether. So we're grateful for your partnership as well. Next, let's hear from our Denver Police Department, Lieutenant Kendall. Updates from DPD.
Yeah, thank you, Kourtny. Thanks everybody for letting me speak today. I really appreciate it. I wanted to just first start by saying thanks to Ryan on this DAP program. It is tremendously successful. The partnerships that you guys have developed down here with PPD and RTD and all the many others that you listed are just tremendously important, I think, for the revitalization of what we're trying to accomplish down here in downtown. And it's working, it's successful. I echo what Deputy Chief Martin Downer said about some of the feedback that we're getting from residents and business owners down there, and it's very positive. Some of the steps that we are taking to kind of support this effort, we have increased our overnight officers' presence down in that location and just in lower downtown in Denver, or in general. Those officers are obviously doing enforcement activities, but we're also trying to be a good steward of the DAT program and try to keep folks from reestablishing in those areas that have already been cleaned up. So we're seeing a lot of great contacts in the overnight hours. And I think that's actually allowing us on Monday, Wednesday, Fridays to have less people in the area that have reestablished in those common areas where they generally reestablish over the course of the evening time. So I think that's a good positive for us. Our DMU, our downtown motorcycle unit, and our hot team, homeless outreach team are working tirelessly to try to get folks connected to the resources that they need, whether that be housing or mental health clinicians, whatever that may be. Our goal is not 100% enforcement. It's also to support folks in getting into housing or into the resources that they need to kind of affect some change and positive change in their lives. One of the really cool things that's coming down the pipeline is getting ready to open, I believe, the AIDS Center. I had an opportunity to tour that recently, and what they're doing at the AIDS Center is just going to be fantastic. And it's going to be a tremendous resource for us from the police department standpoint, but also I think from all of our partners for the DAT operation and just across the city to get people into long-term solutions that can really affect some positive change. One of the other things that we're really doing a lot of focus on and what we're seeing is the public transportation hub there at Colfax and Broadway. We have stepped up our focus and enforcement in that particular location. It is a central location for transportation. It's also become a very central location for illegal narcotics use and sales. Some violent crime has occurred there recently, but I can tell you that the DPD's enforcement and activities as a whole have increased there, and it is paying dividends just in the perception of crime, I think, in that particular location. You're not seeing as many people congregating at RTD. Our partnership with RTD at that particular location is just fantastic. We have seen some displacement from Union Station as well as from the convention center corridor with efforts. We knew that was going to happen, so we have to kind of ebb and flow and be very fluid in our approach to how we attack some of these problems. And that location is one where we're starting to see some displacement of people going to. But our enforcement efforts have increased there and are really doing a very nice job in that particular location. I'm proud of our efforts. Just in general, with some of the crime statistics in the downtown area, good news is that we are down across the board in overall crime in downtown. The police officers that patrol District 6 in general, the downtown area, they are very diligent in their efforts. They're professional. They treat people with respect and dignity, and they do a great job. Our violent crime is down across the entire district, which is a very good indicator that our efforts are paying off. Partnerships with the city attorney's office and getting area restrictions on folks to get them out of these areas where they congregate and do a lot of their criminal activity has been extremely beneficial. And I think with the overall efforts of our partnerships with RTD, Ryan's team, and all the other teams, city attorney's office, the district attorney's office, I think we're gonna be able to see some tremendously quantifiable evidence that this downtown area is going to get cleaned up really well. So I'm proud to be a part of that. Thanks, Steve. allowing us to be a part of that.
Well, thank you, Lieutenant. And I'm really glad that you brought up the issue of displacement. I've talked to a lot of community members about this and really want to reassure and make sure that as a part of our announcement, when we set this out, we said we are very diligent about getting two-way feedback. And I really want that feedback to come from other neighborhoods, other areas of downtown, so that we can work with all of you to ensure that we are creating long-term solutions and not exacerbating some of the inevitable displacement that does occur. So I know you all are very sensitive to that. We are very sensitive to that, and really, at the end of the day, want to do right by the community as a whole. So thank you for bringing that up, and thank you for everything that you're doing.
Thank you, Kourtny. I appreciate it.
Thank you. Well, we will move into some Q&A. So thank you for those who have put questions in the chat. Please feel free to add them as we go over the next few minutes. I do want to announce that we will have several upcoming forums coming up into next year to continue. As we've said from day one, this is not a short-term effort. We know that to create long-term solutions, we need long-term dedication. So over the course of the next several months throughout the first quarter of next year and beyond, but to start us off, you will see sessions similar to this in person as well on February 8th, March 9th, and April 26th. We'll be sending out information on these as the dates get closer. And of course, you can find additional information and updates on that website at downtowndenver.com/safety. So our first question is for Carrie. Carrie, the question has been asked, when you get people into care, is the access immediate care, or is there waiting lists with some of the programs that you are aware of and that you're researching now?
Yeah, so let me back up a little. I think the biggest issue is actually getting people into care, period. So there are essentially two main entry points. And if I get too wonky here, just give me the hook, the signal.
Take your time.
So there is what's called, what people are familiar with, an M1 hold, which is essentially a process that law enforcement and a very specific group of professionals, psychiatrists and physicians, and there might be other limited categories, they can basically bring someone in on an M1 hold, which people refer to as a 72-hour hold. It's not actually that the person has to be held for 72 hours. It's that a medical evaluation has to happen within 72 hours. So that's at a hospital. So it's an inpatient and evaluation. That person's evaluated and have to be within 72 hours. If they're found to meet criteria that requires them to get treatment, then they are what's called certified. The biggest issue we have is that there are so few inpatient beds available, and there's a lot of crisis that folks are kind of making these triage decisions, which I absolutely understand. And so someone gets brought in, and if you're law enforcement and you're bringing someone in, you get frustrated very quickly because that person very clearly needs help and they're being released within an hour because they might not have the higher level of threats that some folks have, maybe self-harm or harm to others, but they very clearly need help and should be getting certified for treatment. The other process is through a court petition. So those are the two entry points. So let's assume that they get certified. They get certified in the inpatient setting, and then you can transition to outpatient. Once someone is certified, there actually are quite a bit of resources available in the outpatient space. And so the big problem has been, I think, and there are many problems, but one of the big challenges has been getting people through that evaluation process, because the evaluation process has to be done inpatient and often requires someone to be held for a certain period of time before they can transition to outpatient. And that's where we have a real scarcity of resources and beds available. So it's not a direct answer to your question. It's a little bit more complicated than saying, are there treatment options available to people? The answer is yes. It's just that there aren't a lot, and then getting them connected to those resources is really difficult. And I think our safety organizations, understandably, are frustrated because they're trying to do their part in bringing people, and then those individuals get released sometimes before that officer gets back to the spot where they, were picked up at, or they get back there before the officer does. So we've had circumstances where we've repeatedly brought someone back and then worked with the entity to say, we need to get this person certified and connected to care. Just because they're not threatening self-harm, they're, out in the street in cold weather, or they have open sores, like they clearly are not able to care for their basic needs. We believe this person meets the criteria to be certified for outpatient care. And just a note here, outpatient care, it's not just necessarily that, we're relying on someone to come back in a week from now. There's truth to that, but because you have to start an inpatient and then transition out, often what happens is that individuals get stabilizing drugs, sometimes long-term injecting medications that will stabilize them and get them out of the mental health crisis, the immediate mental health crisis, and into a position where they will actually start engaging in long-term care.
I think that's worth the explanation. I think it is obviously a huge amount of complexities, but to know that we have those paths and those resources and those tools is really important for the community to know and to support you as that continues to develop. So thank you for that. Next question is for Chief Martingano. The question is, are your officers considered community officers, meaning the same officer at the same location to build relationships with business owners and area customers and residents in that specific area?
Yeah, so that is one of our components of what we educate our officers and train them on is to be community oriented. So the officers right now, they're pretty much all stationed, at Union Station. So if they are not going out there and talking to store owners or customers that are on daily trips and getting to know individuals, then we're definitely doing something wrong on our end of it. But as we branch out, and the future of our agency is we are going to break up, as everyone knows, we go through 2,300 square miles. So that's a pretty big jurisdiction. So we're going to break up into 5 sectors. That's the plan to move forward in 2023. And then that is going to be even more community based to really understand which lines go through each of those areas, reach out to the governmental agencies. But I really think, like I said, the concentration at Union Station, between all, the governmental agencies that are assisting us there, the businesses, the store, the HOAs, we are very deeply involved in the community. And it's really been that outreach and that cooperation and partnerships that has led us to, really understand the issues that everyone is facing, and for us to try to go ahead and mitigate them. So.
Yeah, absolutely. Well, thank you for that. A couple more questions have come in. This most recent one is DDP meeting with RNOs and multicultural organizations to educate them about this effort and get feedback. I'm most certainly happy to answer that question. And if anyone else would like to chime in, please do. A significant part of even the launch of this effort has involved, you saw a number of advocacy partners. We're up to almost 40 organizations that have joined on, have helped shape and give feedback to this effort as it specifically relates to downtown. So I'm really grateful specifically in this space to our partners with the Lodo Neighborhood Association, and UpDoNA, the Upper Downtown Neighborhood Association, as well as others. This is ongoing. We welcome partners to come to the table at any moment in time to offer feedback, to talk about where we go from here. And I also know that DPD, as well as others, have a significant amount of community engagement work that they're doing throughout the city as well. So I'll pause for just a moment after that answer and see if anyone else would like to chime in. But rest assured that we are moving fast and furiously. And if you see someone who is not on that list, or you are someone who wants to be further engaged, please reach out to us, because we are engaging partners on a daily basis in this effort. All right, moving to the next question. Denver Health has a med clinic at 16th in California. Do you utilize the services there? Have you engaged their medical team in your efforts? Again, I'll start just a quick answer and then ask our direct service partners to layer onto that. We at the partnership are talking to Denver Health on a very regular basis and are looking at ways that they can specifically engage. the clinic downtown is obviously is a resource that is being utilized by our team. So I'll ask perhaps maybe Lieutenant Kendall to chime in on that if you have any further details.
I do not, Kourtny. I know it is. We have a tremendous partnership with Denver Health in general. They do an amazing work at all of their locations. I'm not familiar with any specific outreach that we do with them on 16th, but I know that we do utilize that clinic as well as the main campus for 90% of our business, most likely. So,
thank you. And I think it's a point well made to put that more front and center. So thank you for that feedback, and we'll follow up with more details there. Another question, is Denver following the lead of other cities that are connecting unhoused people with resources? Can you talk about their success and what you hope will happen? Again, specifically as the Downtown Denver Partnership, I will talk about this initiative is very much focused on connecting individuals with resources. The holistic approach of having mental outreach, substance misuse, a lot of those real social service specialists out in the field with us is incredibly important. So we have been working with institutions like, or organizations like St. Francis and Urban Peak to ensure that there is broad education on the resources that are available and that our folks out in the field are educated and can make those connections. Again, Lieutenant Kendall, maybe I can ask for you to chime in here in terms of some of the outreach that you're seeing as a part of DPD's resources. And then Ryan, I know you're working with a lot of those partners as well, so please feel free to chime in.
Yeah, thank you, Kourtny. I think to answer the question specifically, Denver is actually in the forefront of what we're doing with the unhoused community. We have done a tremendous amount of research in other cities similar size to ours that have similar issues that we do. But we have also been extremely proactive with what we're trying to accomplish. And quite honestly, we've been very groundbreaking in some of the things we're doing. The STAR program is a perfect example of that. Our OCCs, outreach case coordinators that we have in each of the district stations from the DPD side of things are never been tried before in a lot of different jurisdictions and tremendously successful. So I think to answer that question specifically, we may be leading the way when it comes to how we're handling some of these resource provisions to folks that experience a lot of different challenges that we're facing, not just in downtown Denver, but across the metro area wide.
Fantastic. Thanks so much. Ryan, do you have anything to add with kind of your boots on the ground in the field on a daily basis during this effort?
Yeah, Kourtny, just real quick, I won't belabor the point. I think it's all been answered very, very well, but I will say that's one of the reasons that this has been so valuable is that we've been able to get the professionals into the area to do just that and to be doing the outreach, because they know all of the resources. They know they sit and talk to these people and get to understand what the root cause of the issue is. And when they can understand that, and then they know through their connections and their partnerships who is needed, then we can get the right treatment for the the right treatment for those people, not just any treatment. So that's why having all this specialization out here has been so important.
Yeah, great. Next question, again, Lieutenant Kendall, I'm going to put you on the hot seat. Are any officers walking on 16th Street or just motor vehicles?
No, that's a great question. I see that came from Rob. Yeah, Rob, there are officers everywhere on the mall. As you know, the weather is getting a little chilly right now, so we do spend a little bit more time engaging inside some of those buildings and those businesses with the store owners, and it actually is working out very well for us during this time of year with the efforts that are taking place down on the mall in particular to clean up that area. Engagement with the owners of those businesses and the employees there is tremendously important. So we are on the mall. We have the walk the beat overtime officers that are down there. A lot of the businesses have secondary employment officers also that they hire to work off duty. You are seeing an increase in police cars because it's tough for our downtown motorcycle unit right now to ride the motorcycles because it's so cold. But yes, we are out there with a larger presence than we have been previously. But I think some of our efforts are put more towards that community building, that relationship building with some of those business owners down there.
Thank you for that.
You're welcome.
And another question, and this is regarding reports to PocketGov or non-emergency PD contacts. If individuals are found sleeping on sidewalks and the message has been to report those non-emergency things to places like PocketGov, is there 24/7 response from either of these?
I can
Welcome
answer that
back.
one too. Yeah. Yes, the answer is yes. There is, especially with the non-emergency number. I would always recommend the non-emergency number. There's also the Clean and Safe app, I believe is what it's called. That will get monitored as well. But yes, the non-emergency number is probably the best way. We have also, just so you know, we have increased our patrols for individuals like that and trying to get them connected to sheltering options because the weather is so cold. All of our officers get a bulletin every night that they read on locations where we might need to locate folks that could use some assistance, and we focus our attentions on those as well. But if you're seeing pockets of folks that need some assistance, please call us and let us know so that we can get to them immediately.
Fantastic. Thank you for that. And Ryan, I think we were just softballed a great opportunity to plug our Clean and Safe app and maybe give details as to how that works with our bid security teams.
Yes, that was an excellent plug for that. I appreciate that, Lieutenant Kendall, and it has been a resounding success. I'm so happy to have that as part of our toolkit. It is if you can just go on to the Apple or Google, you can download the Clean and Safe app. You can search Clean and Safe Denver just to make sure, just because there's a couple of them, and that will get it up, get it to you faster. But it is a great way to get our security team on site, and the security team has all the capabilities to get outreach, to get medical services, to call the non-emergency number, PocketGov, whatever is needed, and it's to help DPD and to take some of that pressure off of them and get help to or welfare check to a person as fast as possible. So it's a great resource, and if you don't have it, you need to please download the Clean and Safe app, Denver.
Sorry, we'll all figure out this mute button at some point, right? A couple more questions as we have our last few minutes here today. This one for you, Chief Martingano. What advice can we give to our employees who are taking public transit and who are continually exposed to some of the open drug use? I will say personally, I've seen an increase in your security on the trains, and we're grateful for that. But talk about what our employers can tell their employees.
Yeah, well, first of all, one of the things I would definitely recommend is there's a lot of literature that's been placed out there in regards to, fentanyl, smoke, and others, other drug related, encounters that you may see and walk through. Not saying that everyone should go ahead and be succumbed to it. It's just a philosophy of reading that to make sure that, about your health on that. I know an app was just pitched. We actually have an app as well. It's called the RTD Transit Watch app. This is a great tool because it's text based, and what's good about it is if you are on a train or a bus and you obviously don't want to get on the phone and give a description of somebody that's doing something that's criminal, this is an ability for you to text, and it goes right to our police communication centers. RTD has two police communication centers that receive all those calls and then we'll go ahead and see based off of GPS on radios and other means to find out who's available, send somebody. If not, then we reach out to the 40 cities or the 8 counties that we service for support. This is a great tool to give your employees so that they know how to reach somebody, and please utilize it. You know, we take that data monthly, weekly, and then monthly. We look at it, and that's how we divert some of our resources in relation to our police officers as well as our security personnel to try to be more visible. Just like you said, Kourtny, you know, there's certain lines that with the Transit Watch data being sent to us, we are realizing what times of day that people are seeing some type of incidents, and we're trying to be as visible as we can. And we need, you know, your eyes, your ears, and your thumbs, right, for those text messaging to help us making sure we have the right resources out there.
Thank you so much. And it is so much about that reporting, so much about the communication that is so critical to this, which actually ties into the next question, which I'll address. And if, of course, any of our panelists want to layer on, please do. And the question is, will anything about your approach change in the summer months, and does time of year matter? And I would just say from our perspective and in working so closely with all of these law enforcement partners, that we have to be nimble and respond, because this will evolve. And I don't know that season, I mean, it's truly something that we are monitoring on a daily basis. We're fortunate that we have our own 18 security officers who are deployed every day out really monitoring where we're seeing significant challenges, where we have vulnerabilities, and then working with law enforcement and social service partners to address them. So I would say our approach will evolve as it needs to respond to need, and to also be in front of the need where we can follow trends and get ahead of the curve in order to help people. So if any panelists have anything to add there, please do. Otherwise, we'll move into probably our last 2 questions here. All right. Next question, what services are available to the general public that have interactions with these individuals? Is there training for handling situations of crises when confronted with it in the public? You know, again, I'll reiterate the reporting and the importance of reporting. Perhaps Lieutenant Kendall, could you chime in on any situational awareness training that PD offers for employees? I know our team is willing to help facilitate some of that as well.
Yeah, that's a great question. I appreciate that question. We do, District 6 has 2 tremendous CROs, community resource officers. Austin Munson and his partner are just fantastic. Cassie Ulrich is her name. They are just fantastic at situational awareness training and conversation to get folks to understand what the environment around them is like, what they should be looking for. We recently did an active shooter scenario training at the milk block, the dairy block. That was really, really beneficial, but that's something that we can tailor to individual needs of any person that wants to participate in that. It's free service, doesn't cost anything. I think in general, the most important part of that is just a conversation. Get your employees to have conversations on how they can protect themselves. A lot of people, this might sound funny, but there's a lot of people that don't know how to contact law enforcement services. So that's a part of our conversation too, is how do you get in touch with us? In general, the services that are provided for unhoused community, mental health services, those are available to everyone as well. If you are experiencing trauma, you are experiencing crisis, we will help you as best as we can. And I can tell you that all of our resource providers will help you as well. It doesn't matter if you're experiencing homelessness or not. If you are feeling like what you're seeing downtown is dangerous and you have anxiety about it and you need to discuss that with someone, please reach out to us or to my team, or Ryan can get people connected as well. If you don't feel comfortable coming to the police, that's not a problem. We want to make this downtown area safe, an environment where you feel like you can walk down the street and enjoy all of the wonderful things that the 16th Street Mall and downtown have to offer. And if there's any way that we can help people through that, then we want to do that. So I hope that answers that question, Kourtny.
Yeah, thank you so much. And I think it does then play into just these last two questions, which I'll combine because I think they're great notes to end on. One, and I thank you because I can't see who's asking these questions, but whomever lobbed this one at us, I really appreciate any success examples you can share regarding Parade of Lights and major events. Absolutely. And that is so much a part of the overall feeling and reality of safety in downtown is people coming back. We had over 300,000 people down for Parade of Lights on that Saturday, and just incredible. Any of you who were here know how downtown felt, the vibrancy, the safety. I myself walked from Civic Center down 16th to 16th and Market, and it was just a wonderful experience, really reminding us of the downtown and the city that we all love so much and are so dedicated to. The next question was really, what role can the community play to advance these efforts? So I would say most certainly, first and foremost, come downtown, spend time, and spend money. We need to be present and active as a community in the heart of our city. You'll also on our website find ways for the community to be involved. Again, downtowndenver.com/safety. It's things like report, as we've talked about, supporting our police and our social service providers, really having everyone's back. It's incredibly important for the community right now. Also, get involved in the municipal elections. We have a very pivotal moment coming up for our city, and it's important that we have elected officials who really understand the complexities and the tools and resources that we need to really address and create these long-term solutions. So many ways to get involved in these efforts. And again, it's that website, downtowndenver.com/safety. As a reminder, again, we do have several sessions coming up over the course of the next few months in February and March and April. You can find those dates on our website, and we'll be pushing out information similar to how you received the information today. So we look forward to continuing this dialogue. Of course, reach out to us here at the Downtown Denver Partnership anytime, and we are happy to facilitate any questions for our partners or work with you and hear your feedback on our initiatives as well. So with that, I thank you all for your time this afternoon and hope you have just a wonderful weekend here in the heart of our city in downtown Denver. Thanks so much.